Hip pain is a very common condition for which the diagnosis can be very variable. Probably the most common cause of hip pain in this country is osteoarthritis, which is a degenerate condition in the joint. Most commonly happens in your later ages and years, but actually can also happen when you're young. And sometimes there are underlying conditions which can predispose people to getting premature arthritic degenerative change in the joint. But degenerative arthritis is by far the most common cause. Other causes include trauma to the hip, where people have actually been involved in either a road traffic accident or a sporting injury, where they can damage structures around the hip. They're less common, but they are out there. But overall, I would say probably arthritis is our most common cause, for which we have various solutions for. I think hip pain primarily should be diagnosed on a history of what a patient tells you, and then your own clinical assessment and a clinical examination. As far as investigations are concerned, we have many tools radiologically at our disposal, from plain X-rays, ultrasounds, CT scans, MRIs, and other more sophisticated investigations. To be honest, the most common investigation that we work from, which is still our workhorse, is a plain X-ray. I think treatment options, again, are very variable. We're all very much super specialized these days, depending on the type and cause of the hip pain. For degenerative arthritis, the pain management can be medical, and if that fails, then we have a surgical option, which is very successful in the form of a hip replacement. Other younger patients might have conditions which don't require joint replacement surgery. They might require operations where they have to reset and recut bones to change the geometry of the hip. Sometimes operations can be done through arthroscopic type procedures. So there are lots of options out there for patients nowadays which weren't necessarily available many years ago. But still, probably our most successful operation for arthritic related conditions is still the total hip replacement. I think there's lots patients can do at home for themselves. It depends on the problem that they've got. And if they have an acute sports injury to the hip, physiotherapy works very well to help them get over that. If there's a muscle injury, for example, or a tendon injury, sometimes it does require operative intervention. And actually patients doing supervised exercises before an operation to try and keep their muscles in good condition and to stop them deconditioning, then that's always advised by us as much as possible. The problem is if the condition is very painful, it's actually quite difficult for patients to do what we call prehab. So many of the times, if we've done a surgical intervention which has helped the pain, then physiotherapy and other therapies afterwards can be much more beneficial.